So what are the three main types of altitude sickness?
So broadly speaking, the three main types are acute mountain sickness, which is often abbreviated to AMS, high altitude cerebral edema, which is abbreviated to HACE, HACE, and high altitude pulmonary edema, which is abbreviated to HAPE. So I'll call them AMS, HACE, and HAPE just for ease. And they're all caused by the fact that we've got this low oxygen environment and we're breathing in less oxygen than we'd like to, and then less oxygen than we normally have available at sea level. So AMS, so acute mountain sickness, is the most common type. It is characterized by usually headaches to start with. So lots of people experience a headache as they go up to higher altitudes. And it's generally speaking something that's felt all over the head. It's like a throbbing headache. And it can be mild, moderate, or severe. People can also feel a little bit nauseous, so a little bit sick, and even have some vomiting. They can sometimes have a low appetite or be put off their food, be feeling quite tired, and sometimes lightheaded as well, so sort of feel like they're spinning a little bit. And they're the sort of main symptoms of acute mountain sickness. And not everyone experiences all those symptoms. You might just have one or two. So it's, again, like with most illnesses, there's a bit of a scale of sort of moderate, mild, and severe. But generally speaking, when you do start to ascend to altitudes over about 3,000 meters, you will probably start to feel something, at least probably a mild headache, if you're not used to being at those sorts of altitudes. Then, as we move into the more severe illnesses, so HACE and HAPE, high altitude cerebral edema is basically a swelling of the brain, which sounds pretty dramatic, and it is, to be honest with you. It's a life-threatening condition. Fortunately, it is more rare, and it's usually only seen at the higher ends of the altitude, so more than 5,000 meters, although it is possible lower than that. And that's characterised by a more severe headache, vomiting, and then any signs that the brain is impaired in terms of it's not functioning properly. So, for example, people having difficulty with their balance, losing coordination. Sometimes people describe somebody as looking like they're drunk, even though they haven't had any alcohol or other drugs, because they're just not able to function properly. Sometimes people have difficulty with their speech, difficulty with their vision. And at the very worst end of the scale of that illness, people can lose consciousness or even have seizures. So that is a very important condition that needs to be recognised early and treated rapidly. As I say, fortunately, it's uncommon. And then again, in that category of severe illness is HAPE, so high altitude pulmonary edema, and that's basically fluid on the lungs, and again, all caused by a low oxygen environment. Again, that's can be a very serious condition. It's life-threatening and needs to be recognised and treated quickly. And that's characterised by people feeling very short of breath, usually coughing and feeling very tired. Sometimes that can be a little bit difficult to spot straight away, because one of the main things that we're going to feel when we go to high altitude is short of breath, because there's low oxygen in the air, so we need to get more in by breathing faster. So everyone's going to be a little bit short of breath. But somebody who's developing HAPE is usually significantly short of breath, even when they're resting and not doing any exercise or activity. They're usually feeling really quite unwell, coughing quite a lot, and generally feeling quite exhausted. And if in that situation, they need urgent help, basically.